So, we've been talking about different concepts of health, illness, and disease in medical anthropology. And in exploring this, the use of narrative and understanding the experience of illness, using language, moving beyond a kind of biomedical disease orientation, we can understand the experience of illness, but we can also understand things like cure and treatment in new ways. Tanya Stivers, she's at the UCLA Sociology. She's sort of taken conversational analysis kind of dyadic, that is like two people communicating, a speaker, a listener, has taken that further into kind of triadic communication, group communication, her research into doctor-patient communication, and this challenge, right, that I had said in the introduction to the idea that had kind of become established as a theory in the field that doctors, because of their medical authority, can be coercive in their conversation with their patients. And one of the famous lines for this was, ask no questions. It was from a data set of doctor-patient interaction in which the doctor actually told the patient not to ask questions. And it came to represent this notion of the kind of authority a doctor has and how that can be seen, right, in refusal to answer questions and so on. And so Tanya Stivers really does present a very different kind of picture of doctor-patient, and for this matter, doctor-parent conversations. And so this reading, as we said, is called Prescribing Under Pressure, and it's a big study. It's a very rich study in terms of data. You have about 1,000 individual interactions that are represented in the text, and it's doctors and they are talking with parents that are bringing in their children because their children are ill, are not well. And so the text is many recordings of those interactions and the transcriptions and this kind of an analysis. And what Tanya Stivers kind of points out in the study and highlights and describes through the data collected by conversational analysis is that there's this beginning, an inquiry, and then there's either a symptoms reply or some kind of self-diagnosis of the situation. And then there, from that sort of symptoms-based reply or self-diagnosis, the doctor gives his or her diagnosis and will either confirm or disconfirm a possible self-diagnosis. And on that basis, you may see some kind of struggle that will play out between the doctor and patient. That it isn't as simple as the earlier studies had kind of shown, and this takes it kind of even further by not looking at simply like domination, right, but a struggle, a give and play in terms of power. And ultimately what she's going to argue is that parents have the power to shape the conversation with the doctor, that when they come in and they immediately put a diagnosis, that sets the doctor on a different kind of footing. And that really does force the doctor to negotiate rather than simply put forward some alternative diagnosis. The doctor is going to have to deal with the patient's own self-diagnosis, and the conversation won't end really until that struggle is completed and there is some kind of agreement that is developed. And she shows that, in fact, when they do parents that is come in with children, and they come in with a pre-existing self-diagnosis, that they can actually increase the probability of whether or not the doctor will actually give a prescription for antibiotics. The chapter called No Problem Diagnosis Resistance sort of is focusing on one subset of the conversations between parents and doctors. And in the subset, the doctor basically provides a diagnosis that there is no significant problem. There doesn't need to be any particular kind of treatment. There won't be a prescription of antibiotics forthcoming. And in the case studies, that often that will trigger resistance from the patient. The patient, as a parent, is coming in because they are concerned about their child, and their intention is to leave with something that's going to fix the problem. And this was really clear in her data. And so they, at this point, then they question the doctor. They may raise questions about the diagnosis. They will seek evidence or justification. And that's where that doctor can pivot and sometimes back down if the resistance from the parent to a no problem diagnosis is too strong. They will back down. That was seen in the data itself. And so you can see sort of in this particular data set, the doctor at line 24, right, begins to waver, if you will, on the original diagnosis, is pivoting, if you will, from no problem, right, to, well, okay, now you're putting up another possible diagnosis that would be bacterial and thus would potentially warrant the prescription of antibiotics. You can really see that very clearly from the data, right? Moving down this conversational analysis that's been transcribed, you can see how if the parent is presented with this no problem, that it will raise the guards up of the parent, and they will then resist, forcing the doctor to take some sort of verbal step or move. So the conclusions here, and thinking about this kind of case study. So Stivers is showing us, right, conversational analysis in an exploration of how do we characterize, right, the interaction and social relationships between doctors and parents. Is it the case that if we're looking at the politics of medical interaction, that doctors are overly empowered and patients are disempowered? Well, for Stivers, in describing the structure of the conversations between parents and sick children and their physicians and their doctors, she's actually noted significant ways that patients do have power. In this case, it's a problem because of the issues around the overprescription of antibiotics and problems around the ineffectiveness, right, of something that is designed to kill bacteria for, let's say, some kind of viral infection. When patients challenge a doctor's diagnosis, due to the nature of social relationships and this kind of coming to an agreement that we see embedded in the nature of what language is, when that challenge is put forward, it can absolutely influence the ultimate treatment that a doctor will pursue.